Hi, I'm Jill Stokeld. I'm excited today to be here at the Baton Rouge Clinic at the main office, and I'm joined today by Dr. Redhead and Dr. Edmonson. Thank y'all so much for visiting with me today. I'm excited to learn more about what's going on in your world. So tell me, what type of patient do you typically see as a board-certified allergist and immunologist?
Yeah, so the typical patients we would see is your allergic rhinitis type patients, asthma, eczema, recurrent infections, patients with food allergies, possibly anaphylactic reactions, chronic sinus infections. Those are the typical patients we would see.
And you see both pediatric as well as adult patients, correct?
Yes, we see all ages.
Okay. Who is a candidate for allergy shots? I hear a lot about them, but I don't really know who does that best work for.
Anyone with chronic and severe upper respiratory allergies or sinus allergy is certainly a candidate for allergy injections, especially if they're difficult to control with medications. It also works extremely well for insect sting allergy. That's a life-threatening allergy that we can cure almost all of those patients with desensitization.
That's great, especially for our neck of the woods where we live. So who is responsible and who can administer the allergy shots?
So typically we would recommend seeing a board-certified allergist to administer the allergy shots. When we do allergy testing, we're kind of tailoring it to each patient that comes in.
So, I know you mentioned you recommend the allergy shots once do you start with medication or do you start with the shots, or does it really just depend on the patient?
Well, the treatment of allergy is threefold. Number one, you always try to avoid as best you can what's causing the allergies. And then we have medications to treat allergies, bearing in mind the medications only block the symptoms while you take the medications.
Right.
So they never cure the allergies in any form or fashion. And then the allergy injections is our way of trying to reprogram the immune system to stop overreacting to what's causing the allergies. And in the end, it's effective for respiratory allergy patients for about 90% of the patients. Most of them get long-term reduction of their allergies, and some of them you cure. And then again, the insect sting allergy, you cure almost everyone.
That's great. So talk to me about, you suspect maybe you or maybe a loved one has an allergy. How do you go about allergy testing? What is involved with that? What does that look like?
Yeah, so the testing is typically pretty easy and not very painful, maybe some small irritation. We put a small amount of allergen on a tiny little pick, and we barely pick the skin, and then we wait to see if it has a reaction. So when we do the testing, we typically are testing for different pollens, grass, tree, weeds. We also test for cat, dog, dust mite, molds. We typically get the answer in about 15 minutes.
Okay.
And I have a little pick that I was going to show for you.
Okay.
So when we do the testing, I'm going to show it on your arm. It's just a tiny little pick, and we barely pick the skin and just pick up. So
that's literally all it is?
That's it.
That's it.
Okay, because I've always heard about the pick test, when I was younger, and it frightened me. That was literally nothing. I didn't think you were actually sick. I thought you were being nice to me.
Yeah, so when we do it for kids and whatnot, for the most part, we'll kind of show the kids before we do it, show them that it's really not a needle, it's not going to cause blood, it's not a shot, and usually we can get any patient, any age, we can do that testing for.
Wow, that's great. I'm so surprised about that pick test. So is that also how you test for food allergies as well?
Yes, absolutely. So when we have patients come in and let's say they ate peanut and had immediate hives, had respiratory issues, maybe some gastrointestinal type symptoms, that's the way we would test for those too. So typically with food allergy, we'll see patients and they have immediate symptoms. It's going to be reproducible, and we can do the same exact testing to identify what they're allergic to.
Do you find that people seek your help, or are they more resistant to it because they think, oh, well, this isn't really that big of a deal, and is there, or are people like, I need help with this?
Well, a lot of our patients are self-referred because they suffered for so long, but there are many patients that will sit there and not seek help, and they could easily be helped long-term, either reducing or even curing their allergies.
I'll add, a lot of patients don't know that allergy shots are as effective as they are. If they're given properly, 80 to 90% chance that we can cure, we can retrain the immune system, and we can desensitize it to where they're no longer allergic to those allergens. So when they're exposed to certain pollens, they're no longer having the runny nose, the congestion, the sneezing, the itchy red watery eyes.
So does that mean, oh, sorry.
I was going to say they don't have to suffer.
Right.
I mean, there is treatment.
Right. And so if they are cured, that means then they can stop that specific allergy shot, correct?
In due time. It's,
Yes,
it's an extended course of
right.
injections, usually 3 to 5 years to obtain that type of control.
Which versus a lifetime is a short amount of time.
Exactly.
I'm here now with Madeline. You are one of Dr. Edmonson's patients. Okay, so I understand you've received the allergy shots. Why don't you walk us through a little bit about your experience?
So prior to ever coming to see Dr. Edmonson, I was always in and out of urgent cares. I would receive steroids, antibiotics, everything. I was constantly, mentally and physically, just drained on a day-to-day basis. I would have the nastiest coughs. Oh yeah.
So
nasty.
you didn't know, and so going and getting the steroid shots were just like a quick fix, but it wasn't solving the problem.
Exactly. I didn't know it was really allergies. I'd never truly understood what they meant prior to seeing Dr. Edmonson. But ever since I started coming here, it's been great. She allergy tested me, and I found out I was allergic to cats, dogs, trees, grasses, weeds, dust mites, and molds.
Pretty much the outside.
Yeah, and
Okay.
I have dogs too, so that doesn't really
Oh,
help either.
Okay, yes.
And I would always have rashes and hives on my legs in high school. So I kind of knew I had some allergies, but I just never truly knew the extent of it. So once I started getting allergy tested, everything was explained to me. I was like, no, let's go for it. If it'll fix this problem, I'm totally for it. So I started receiving them 3 times a week. I get 3 shots, 2 in one arm, 1 in the other. And it'll flip-flop usually around every single time I come in. But I would probably say pretty quickly, month, 2 months, even as I was building up to my tolerance dose, that I noticed my coughing going away, just my whole demeanor. I got happier, honestly, because I felt better.
Right.
Yeah, exactly. So I even sometimes forget that it's my time to go to get my allergy shots again because I've noticed such an immense change.
Oh, that is fantastic. So what would your recommendation be to people if they can't figure out what's going on with them?
I would definitely start by going see an allergist, get tested, figure out what's going on, and if allergy shots are an option, I would definitely do it, because for me to not be allergic to those things 3 to 5 years down the road, that's a great outcome.
It's worth it.
Definitely.
Thank you so much for talking with us today.
No problem.
Thank you both so much again for your time. I really enjoyed learning about all of this, and we're in a very favorable climate, I feel, for allergies.
Yes.
So y'all are a great resource. So when you're looking for your next board-certified allergist or immunologist, please check out the Baton Rouge Clinic and support local.